Hey everybody, welcome to this week's video. My name is Daniel. Daniel teaches the psychology student, bringing you his 2 cents from his lectures and all that other good stuff. Today we're going to talk about self-help versus therapy. Now, it's important to note, self-help is not therapy. And I would argue a lot of the people who are into self-help could really benefit from using therapy. What are they? How do they differ? Historically speaking, self-help has always been intertwined with goals, looking further. It's people who would see that they're relatively mentally stable, whatever that means, and that they want to pursue their goals, and that they're looking for extra encouragement and extra motivation and some guy telling them to take responsibility. So they're looking forward. It's not as much as like looking at your past. Therapy, traditionally speaking, was a lot of looking at your past. How did you get here? Let's talk about your childhood. Let's talk about your family. Let's talk about your relationships. Let's talk about your current life. Okay, let's talk about where would you like to be in the future. There's a lot of overlap between some people who might make self-help videos, like those life coaches, life gurus, and psychologists and psychiatrists. A big thing that you'll find in the self-help world, which I want you to be careful of, is there's no giant organization that regulates everyone. What I mean by that is whether you live in a different country, whether it be America, whether it be Canada, an individual province or state, to be a counselor, to be a therapist, to be a psychologist, there's a certain license that you have to get. In order to be a practicing family physician, or in order to be a lawyer, there's something that you have to pass to become one, right? There's an organization, there's someone overlooking to make sure that everyone's following the same standards. This is a big thing where accreditation comes in. Accreditation? Am I saying that right? Accreditation? You know exactly what I mean. It's when a university or a college has a certain program and there's like this overviewing body or organization which looks over it and goes, yep, like it's accredited. We state the fact that this meets the standards that we've set, and so do these other universities. The problem with self-help is this. Anybody could make a book and say some motivational slogan. Anybody. And that doesn't mean it's good or bad or neutral. That's for you to decide. The only worry is if anybody can call themselves a self-help guru, a life coach, or whatever, be careful about the advice that they give you. A young 15-year-old Daniel would listen to a lot of these people, and they were very motivational, very encouraging. They could speak well. They could change their tone of voice. They could increase their volume and decrease it to get people to lean in, and it was truly exceptional. One concern of mine came when I felt like people in the self-help world were overstepping their bounds. Meaning, I would actually hear stories of people approaching these coaches, talking to them about past traumas or about anxiety issues or about problems that may have been out of their reach. But because you can make a lot more money being a self-help guru than being a psychologist, they take them on anyways. If you're a psychologist or counselor or therapist of some sorts, you can charge anywhere from average state $90 an hour up to $300 an hour. Mind you, insurance will help out as well. Now, generally, the more you've studied, the more you're going to charge per hour. Why? It's a reflection of the experience and the knowledge that you can grant someone. So it's not like you're paying for the time, you're paying for the knowledge that this person can give you. The psychologist, the psychiatrist with God knows how much experience. Then on the other hand, you've got these coaches or these self-help gurus who they can charge quite a bit. $200, $300, $400 an hour. They have not studied psychology. They're not familiar with the different medications and SSRIs. But you will pay them $400 so you can speak about astrology and different energies and looking out for signs and manifesting from the universe. And look, if you're listening to this going, Daniel, you're talking down to people who do that. I'm not at all. What I simply want to demonstrate is that there's different avenues and there's different rules for whatever you're experiencing. And you should be careful of if you have an issue or a concern that you think might be too much or inappropriate for a coach or a self-help or a motivational guy to take on, it won't end too well for you. And the difference is this. You go to one of these coaches and you say, look, I'm not doing well. I feel bummed out because of whatever. Some of the recommendations are going to be similar. They're going to say, well, look, let's look at your nutrition. What are you putting into your body? Let's look at your relationships. Are you exercising? And a counselor and a therapist might say the same things. So it's not a this is better or that's better. It's just what is appropriate for your situation. If you're a young man or woman looking for some motivation, looking for some encouragement, if you want to talk about goal setting, a life coach or people who make videos based on chasing your goals and manifesting and visualizing, that might be the perfect thing for you. But if you want to talk about anxiety, if you want to talk about anything mental health related, and whenever I say mental health, people immediately jump to the extremes: bipolar disorder, schizophrenia, psychopathy. Folks, this might just be stress, work stress. This could be some anxiety from work. This could be being sad for a prolonged period of time. And look, even that we have to be really, really careful. If I tell you that John has been in his room for the last week, he hasn't showered, he hasn't talked to anyone, he hasn't gone to work, is that abnormal behavior? With that context that I've given you, you're going to say yes. Now, if I tell you that John's mother recently passed away, all of a sudden his abnormal behavior becomes normal. If I tell you John's mother passed away, they were very close, to the next day he's smiling and jolly and friendly and he's acting as if nothing's wrong, now that's abnormal behavior. So what we understand is this idea of abnormal and normal is very, very important to the context of the situation. Not only what's going on around this person's life, but also culturally. You could have something that, for example, is deemed normal in one culture, but totally abnormal in another. For example, let's say sleeping around before being married. I'm going to make a huge generalization here. In the West, it might be more acceptable. Then maybe you go to a couple countries in the Middle East and you start talking about sleeping around with different people, especially if you're a woman before marriage. Now all of a sudden that becomes abnormal behavior. You take that exact same behavior, you put it in a different geographical location with a different cultural context, that's not a problem. So we understand that there's differences between both, and we also understand that there are similarities and there's things that both of them want to do. Both ideas, whether you're looking at self-help, whether you're looking at therapy, they want to help you organize your life and they want the best for you. Now, self-help, much like therapy, is going to have many different approaches to it. In therapy, one of the things I can tell you is, or psychotherapy they'd call it, is there's different psychological approaches, meaning you could have a psychoanalytic approach. Psychoanalytic approach refers to Sigmund Freud, people like Carl Jung, even Alfred Adler, who talked a lot about dreams, who talked about the unconscious, who talked about these implicit things that you want to do that maybe your conscious mind isn't aware of, that would revolve around being defensive and unconsciously defensive towards things. Another aspect of that could be a behavioral approach. If this is interesting to you, type in Ivan Pavlov on YouTube or a gentleman by the name of B.F. Skinner. This is a lot of looking at objective, concrete behavior. So writing down, if you keep biting your nails, how many times do you bite your nails in a day? You know, like having homework that will actually analyze your behavior and then rewarding positive behavior. Hey, every time you exercise, I want you to reward yourself with 2 of those little caramel chocolates that you love. So that's like a behavioral approach. Then you've got another approach, let's say humanistic approach, which focuses on a gentleman by the name of Carl Rogers and another one, Abraham Maslow. So if any of these are interesting to you, you can YouTube them. They're all psychotherapy. They can all help individuals benefit throughout the therapeutic process, but they all have their slightly own different perspectives in terms of how much to confront the individual, how much to be passive, how much to talk, whether to ask more questions, be more assertive. And self-help, I would argue, is very similar. It's generally a guy who might be quieter, who might be more relaxed, might be more eloquent. It could be a guy who's kind of got like a military thing to him. If you guys know this gentleman by the name of Eric Thomas, that's someone I've come across. You could put Jocko Willink in that category. Joe Rogan, I've seen clips of him just in his podcast that have been smalled down, thrown onto YouTube Shorts and TikTok about going after it. So you have these different personalities, and essentially they all want to do the same thing. They want you to benefit. The big thing to recognize is, what is the problem that you have right now? And what do you need? Or what could offer you the most appropriate solution? And be careful. Look, there's nothing wrong with listening to the Jocko Willinks and the Joe Rogans of the world if that's your cup of tea. But if you're in a bad place, and I mean like a really, really bad place, and you'll know, you felt sad before, but this is different. You felt a little anxious before a test before, but this is different. Don't lie to yourself. And when you recognize that, you got to go, oh, like I know self-help influencer number 1 is telling me positive vibes only. And self-help influencer number 2 is telling me to just exercise and just work through it. You know, and trauma makes you stronger. But I know what I should do, but I just really need to listen to someone. Like I really need to listen to someone. I really need someone to listen to me and to listen to my problems. Because I know exercise is good for me. Look, one thing that always makes me upset is when you look at people who are struggling with different mental health things, is we almost speak to them as if they're ignorant of what makes them better. Like, if you're not in a good place mentally, you know exercise is going to make you feel better. You know you should pay attention to your nutrition. You know you should have some fun. You know you should go out and take a walk. You know you should talk to your friends. The problem is it's extremely difficult to. And then when those self-help influencers come along and say, well, you got to take responsibility. You should stop being lazy. You should stop complaining. I did it. This was my background. So you can do it too. Be careful. Be careful with that sort of a mindset. Just because you did it doesn't mean I can do it. If me and you are going to the gym, and you go to the gym all the time and I never go to the gym, you do 30 push-ups. I do 1 push-up. And I tell you, hey, aren't you proud? I did 1 push-up. You go 1 push-up, Daniel, who cares? I can do 30. So what you've just done is you've compared me to you. Rather than saying, Daniel, last week you couldn't even do a single push-up. But now you can do a push-up. Look at that growth. That's amazing. I see a lot of little clips on YouTube, on Instagram, on TikTok, people saying, look, there are kids right now around the world, in Africa, starving, not knowing if they're going to have a meal tonight. And you're upset because your supervisor is being an ass? Pathetic. Look, let's walk through that logic together. Imagine me and you are sitting in a coffee shop, and you're telling me about how your wife of 12 years is having an affair. And I go, look, Brett, there's kids right now in Africa who don't know if they're going to eat dinner tonight. And you're upset because your wife had an affair? Pfft, pathetic. Do you see how that's ridiculous, folks? Are we all on the same page here? Other people have it worse. Sure. But they're not me. They don't have my genetics. They don't have my brain wiring. And guess what, man? Other people have it better. Well, I did this and this, and I grew up from a poor place, so I had it a lot harder than you. You have no right to complain. This is the only life that I've lived. Logically, what you're saying makes complete sense. If we were to compare problems, that other guy would love to have my problem. But at the end of the day, I'm me and he's him. And I've only lived this life. And you grabbing this guy who has terrible self-esteem and has depressive symptoms, pulling him to the side and saying, if you live in America or Canada, you have no right to be depressed. If you have clean drinking water, you have a roof over your head, you've got 2 parents, you've got no right to be depressed. Who says? Who says? Why? Because you're not depressed? Because people have it worse. You go to that kid, and I'm really just exaggerating and I'm trying to be funny, like, because they always point to, there's kids in Africa, like, okay. Imagine going to that kid in Africa and he tells you, yeah, like, I don't know if I'm going to, like, eat tonight. Like, I don't know if I'm going to have dinner tonight. And then one of his friends tells him, it goes, look, Matumbo, did you know 1 in 5 kids in Canada goes to school without eating breakfast or lunch because their parents can't afford that? 1 in 5. I just made up that stat, but I promise you it's a noticeable stat. So the problem is, if we keep comparing ourselves to someone who has it worse, we'll never end. And there's this really weird place where people think about therapy and they go, oh, it's a place to complain. Why would I go sit across someone who has his own problems and just complain or make excuses? And look, I hear you. And I don't disagree. Because excuses sound like we're not getting anywhere. I wouldn't even look at it as excuses. I would look at it as acceptance. You're accepting the current life circumstance. And acceptance does not mean maintenance. Meaning, if you accept that your life is a certain way, that doesn't mean that you should maintain it. You show up to a counselor's office and you go, look, I'm not physically in the best way I should be. And your therapist says, well, tell me more about that. And you go, well, I could be working out more. I could be eating better. I could be doing this, and I could stop smoking, and I could do that. So you accept the situation, and then you recognize how you could be better. And you find out where you are, and you find out where you want to get to. And together you help to make that trip. So be careful, because the whole self-help thing about take as much responsibility as possible. A huge fan of Jocko Willink. I am. And he says something that's called extreme ownership. Take ownership almost anytime you can. That has its benefits. But if you're a person who's growing up in a family that is abusive, that is neglectful, that is harmful, and you start to take ownership for things that are not your fault, my friends, this is how we lead to toxic relationships. This is how we lead to the girl who would be physically abused by her partner, and she would take responsibility for the abuse. It's my fault. I annoyed Jackson, so Jackson just reminded me who's in charge. If there's one thing that you take away from this video, is that we have to be very careful with absolutes. Whenever someone says take responsibility, whenever someone says don't take responsibility, whenever someone says push yourself hard, whenever someone says don't push yourself that hard, there are no absolutes, or so I don't believe there are. Or if there are, they're very far and few in between. Now, for the most part, we want to be careful about how we think about things. We want to be careful about how we motivate other people. And we want to be careful about comparing ourselves to others or our friends to others. Whether we want to encourage them, and oftentimes we end up discouraging people. Oh, look, you're complaining right now? Well, so-and-so has it 10 times worse than you. So you have no right to complain. So now that person feels guilty. And now they feel like there's something wrong with them. Because why am I complaining about this thing? Daniel's right. That person has it a lot worse than me. Therefore, I have no right to complain. Therefore, there's something wrong with me. I'm a loser. I'm lazy. I'm blah, 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 blah. Look, there's a small minority of people who might, I want to be careful with what I say here. Not benefit, but who could tolerate that sort of advice to go, you're a freaking loser. Your neighbor has got it twice as worse as you, and look at how good they're doing. If they can do it, you can do it. There's a group of people that are going to look at that and get inspired and go, you know what? You're 100% right. But there's a huge group of people that when they're in a bad situation and you compare them to someone who's in a worse situation, they're going to think to themselves, wow, look at them going. I guess there must be something wrong with me. I guess I'm more terrible than I thought I was. Because clearly when I compare us and I'm complaining, I'm ashamed of myself. And now I'm going to think twice if I have to ask for help. And I'll just keep it in myself. Ladies and gentlemen, welcome to Mental Health. Welcome to Men's Mental Health. Welcome to the world of self-help and therapy. Welcome to the world of paying $600 so someone can help you manifest your true reality. You've got depression? Forget therapy and that nonsense. Buy yourself a couple of crystals, okay? Purple and blue and red. It'll do the trick in about 2 days. Forget all that nonsense. That guy studied for 10 years to help you out. He's a goof. Buy these crystals, all right? Smell these herbs, and the rest will take care of itself. That's what some people would tell you. I'm not going to name any names, but that's what some would say. What I would say is, be a critical thinker. Be self-aware about who you are and what you need. And be very, very careful the next time you give someone words of encouragement or advice, or you begin to compare. You never know the effect that that's going to have on somebody. Thanks for listening, folks. Stay safe. Bye-bye.